Welcome to Endometriosis Voices, listening to lived experiences, learning from science. I am Isaac Chebafo. In today's video, we are talking about something many people with endometriosis know too well, being told that your symptoms are normal. Research shows that people often wait 7 to 10 years from the first symptoms to diagnosis of endometriosis. During those years, many are told it's just bad periods, everyone feels like that, or you are worrying too much. This video is not intended to point fingers at anyone. Rather, it's about understanding how symptoms normalization happens, how it can delay diagnosis and make endometriosis sufferers feel alone, so that together we can start changing the pattern. What then is symptoms normalization? Symptoms normalization is when an unusually severe symptom is associated or treated as if it's just part of life. Several studies have shown that endometriosis sufferers, health professionals, and family members who are supposed to understand sufferers' pain and offer them the needed support often see severe menstrual pain as something that should be pushed through rather than a sign of an underlying pathology. Imagine a teenager who has to miss 2 or 4 days of school every month. During this period, she lays on the bathroom floor with severe cramps, nausea, and vomiting. And when she finally mentions it, she hears things like, "That's just what periods are like. In fact, your mom had bad periods too, and you get used to it as you grow." Over time, she may start believing that needing strong painkillers, a hot water bottle, or a sick bucket is part of just having a period. That belief can delay asking for help, not because this teenager is weak or careless, but because she has learned that this level of pain is normal. Beyond the endometriosis sufferer herself, healthcare professionals who are not expert endometriosis clinicians are also likely to see severe period pain as common rather than a possible red flag. Let's walk through a classical case scenario. A 22-year-old career woman has severe period pain that makes her vomit, have diarrhea, and miss work. She's exhausted all her sick leave, and when she manages to push through to go to work because she has no other choice, she's identified it reduces her work output significantly and in turn affecting her career growth. However, she waits several years before talking to a doctor because friends and family members have mentioned to her all too often that having severe period pain is just part of womanhood. She also sees a repetition of reels on social media that affirms that severe period pain is part of just having a period. At the first appointment, she is encouraged to try over-the-counter pain relief and come back later if it doesn't improve. None of this is malicious, but if the cycle repeats a few times, this young woman might live with endometriosis that is untreated for most of her 20s before anyone mentions the word endometriosis to her at all. This is how symptoms normalization delays endometriosis diagnosis. Symptoms normalization does not just delay endometriosis diagnosis. Normalization is not just only about time. It's about how people feel about their own bodies. A growing body of research has found that living with endometriosis can involve loneliness. When pain and fatigue are repeatedly labeled as normal or exaggerated, people may start to question their own experience. If everyone else copes, maybe I'm just weak. They also tend to hide their symptoms at work, in school, and relationships to prevent being labeled as dramatic. In addition, they may withdraw from society because they worry about cancelling plans or being misunderstood. One study has found that anticipation of stigma, fear of not being believed or being judged, was linked to a greater loneliness and feeling of less supported. Another review described how stigma and symptoms normalization can contribute to anxiety, depression, and in some cases, suicidal thoughts. Let's take a classical case example. Someone with endometriosis is invited to a friend's birthday dinner. She is in severe pain and decided to cancel again. A friend replies jokingly, "Is this your period again?" Everyone laughs. No one means harm, but the person with endometriosis feels embarrassed and misunderstood. Next time, she may just say, "I am busy," instead of explaining the real reason. Over time, this can lead to a pattern of isolation. But this is what I want to tell you. Pain is not what someone validates, but what you feel. If you are feeling severe period pain that is unbearable, interferes with your school, work, or social life, you shouldn't allow anybody to dismiss it. Insist on it and get the support that you need. It is important to mention that these patterns didn't appear overnight, and they are not the fault of any individual, whether the endometriosis sufferers, their clinicians, and/or family and friends. Studies point to a wider web of influence. One of them is cultural taboos that make it difficult to openly talk about menstruation. There's also limited education on what healthy period should look like, which I have covered extensively in my previous episode. Healthcare systems are also under pressure, and cohort consultation make complex pain conditions harder to explore. There's also gaps in training about endometriosis, especially outside specialist clinics. Clinicians who care deeply about their patients can even underestimate endometriosis symptoms simply because the system hasn't given them enough tools. And people living with endometriosis may minimize their own symptoms because society has taught them that menstrual pain is something to be endured quietly. Recognizing this bigger picture isn't about blame. It's about creating space for change. When patients, partners, teachers, and clinicians understand how normalization works, it becomes easier to notice it and gently question it. Against this backdrop, there is a need to institute programs geared towards moving away from endometriosis symptoms normalization to validation, and in turn shorten the diagnostic journey and reduce isolation. One of such programs that can be instituted is better public education, which I have covered extensively in our previous episode. There's the need to improve education about what severe period pain looks like and when to seek help. Secondly, there's also a need for clearer clinical pathways so that people with persistent symptoms can be referred to specialists sooner, and this thumbs up to Australia. Third, because loneliness and stigma can be just as heavy as physical pain, there's also a need to institute support and emotional well-being centers. To endometriosis sufferers, here are some gentle, practical steps you might consider if and when it feels right for you. 1. Track your symptoms: bleeding, bowel discomfort, fatigue, and how often they disrupt your day. A record can make patterns clearer when you are explaining these symptoms to your clinician on your consultation. Second, use language that reflects impact rather than intensity. Rather than explaining the intensity of your pain, use language like "I miss work or school several days every month when I am on my period," or "I can't stand up straight for hours." This is the kind of information studies have shown can help highlight when symptoms are not typical. Third, seek a second or a third opinion. If you feel your concerns are not being explored, especially when pain is persistent and life-threatening, seek a second opinion. Suggest referrals that you think can help rule out or identify endometriosis if it exists. Finally, connect with others. Whether online or in local groups, connecting with other people can buffer some of the loneliness and stigma associated with endometriosis. If you are watching this, your response to your symptoms was in the context you were given. You did the best you could with the information and support you had. Wanting answers now is still completely valid. To conclude this episode, normalizing severe pain can keep endometriosis in the shadows, delay diagnosis, leaving people feeling alone. But every honest conversation, every valid story, and every informed appointment pushes back against that. If you feel comfortable, share in the comment one moment when you realize your pain wasn't just normal. Your story might be just a sign someone needs to be able to seek help sooner. Thank you for being here and for taking your symptoms and your well-being seriously. Endometriosis Voices, listening to lived experiences, learning from